I love working at Charter. We have very well trained staff. We have most state-of-the-art imaging equipments and our image quality is second to none. So we utilize various advanced cutting-edge neuroimaging techniques, and these include brain perfusion imaging, diffusion tensor imaging, then quantitative volumetric evaluation of the brain and lesions within the brain, and our latest addition is molecular and functional imaging of the brain using a hybrid PET-CT scanner. So this machine behind me is one of the most advanced wide-bore 3 Tesla MRI machine. We utilize this machine for several cutting-edge neuroimaging techniques. These include brain perfusion, diffusion tensor imaging, CSF flow study, dynamic imaging of the temporomandibular joints, and very detailed evaluation of the neural structures including cranial nerves, brachial plexus, and lumbosacral plexus. So at Charter, we are active in several research projects, including an Alzheimer trial. Under this specific trial, patients with memory difficulties, they are directly enrolled with the dementia specialist and neurologist. After their initial clinical consult, we start with 3 Tesla MRI of the brain to look for any structural abnormalities. Then we run a very special artificial intelligent computer application to measure volumes of the brain in specific areas that are key in our memory function. And this special application allows us to detect very early atrophy that we are not able to do with the traditional MRI. So Alzheimer's disease is the most common form of the dementia. It accounts for more than half of all the dementia cases. The hallmark of Alzheimer's disease is abnormal protein deposition that happens inside the brain. This deposition occurs gradually over a long period of time and starts several years before the start of any clinical symptoms or memory difficulties. Now at Charter Radiology, we have the capability of directly imaging this abnormal protein deposition inside the brain using our 128 slice PET-CT scanner. So amyloid PET imaging requires simple intravenous injection of a radiopharmaceutical agent followed by imaging in our PET scanner. These images provide us the direct measure and status of the abnormal amyloid protein deposits inside the brain. If amyloid PET scan is negative, we can safely say you have no Alzheimer's disease with almost 100% certainty. On the other hand, positive amyloid PET imaging increases the likelihood of the Alzheimer's disease. This is a very important information for our dementia specialists and neurologists, and it helps them to select appropriate treatment for their patients. Our team at Charter is committed to provide highest quality imaging services to our patients with utmost safety, comfort, and compassion.